We're talking to Dr. CPoe, and the topic is the massacre at Blacksburg, Virginia. And of course, Dr. Poe, let us give you an opportunity to continue that analysis that you were making in terms of isolation and how this young man perhaps was isolated. Go on, speak to it from that perspective.
He obviously was socially isolated. I'm convinced that he was spiritually isolated. I doubt very seriously whether he had any spiritual support, and that would be a church or a temple or some other place of worship. So this man was in severe pain. I'm convinced he had a deep sense of inferiority. I'm convinced that he was deeply envious and jealous of those around him. He obviously was most jealous of people who were wealthy and affluent. And I believe that he directed then his envious rage towards them. He perceived them as having harmed him, as having mistreated him, as having hurt him, and I believe that he at some point made the decision to get even. He decided to get revenge against them whom he felt inferior to, whom he felt were superior to him. And we see that quite a bit in people who become violent. They often become violent towards whomever they feel is superior to them. And that generally means they are suffering from deep feelings of inferiority. And of course, along with deep feelings of inferiority go feelings of helplessness and powerlessness and worthlessness. And so I think that the gun gave him a sense of power, gave him a sense of being in control, gave him a sense of being superior, a sense of being dominant. And so we see that in him. Now what bothers me is there were many signs that this young man was in severe distress. The stalking was a sign, him saying he had an imaginary friend whose name was Jelly. He described her as a supermodel. Of course, the isolation from other people, the not talking, all of these were signs that this man was severely hurting. Of course, we know he was referred to mental health resource. They evaluated him. They sent him before the judge. The judge declared that he was an imminent danger to himself, but he was not committed, and he was referred for mental health counseling. Unfortunately, Dr. Haney, the present statute in the state of Tennessee says that you can only civilly or involuntarily commit somebody if they're dangerous to others, dangerous to themselves, or gravely disabled. The only problem with that, sometimes, say if a police officer comes out to a home to evaluate a person who has been reported as being dangerous to himself, others, or gravely disabled, unless the person is showing some violent behavior in front of the police, toward themselves or towards others, the police may not take them in. So we need to take another look at our mental health system in terms of helping people to access mental health resources that are available. And I think too many times we allow the statute to keep us from extending help to somebody who really does need help. I think that the tragedy at Virginia Tech is a wake-up call to the mental health community. We need to evaluate the accessibility to our treatment resources. I think we need to make them more accessible. I think we need to expand mental health resources. You know, would you believe Baptist Hospital does not have inpatient psychiatric beds? Metro General does not have inpatient psychiatric beds, and a lot of hospitals have closed down their inpatient psychiatric facilities because of the fact it's not cost effective. The length of hospitalizations have been telescoped down to about 3 to 5 days for the average person. So we don't have adequate mental health resources. In addition, I want to say that the resources that we do have are limited in my view. Most often psychotherapy is psychosocial, biopsychosocial, okay? Rather than being biopsychosocial spiritual. We need to include spirituality in our assessment of persons who come in for help. We need to include spirituality in our treatment of persons who come to us for help. Because sometimes psychotherapy traditional is not enough. Sometimes pharmacotherapy or drug therapy is not enough. We need to include spirituality in our assessment and our diagnosis as well as in our treatment.
Well, you know, as you said, that this might indeed be a wake-up call, and it's rare that we hear the problems in our mental system the way you're expressing these problems now. And it seems to me that this is the kind of thing that if we wanted to become involved, certainly it might mean we have to put greater financial resources, but the outcome is that if you could somehow minimize the situations that you're having in Virginia, that would be well worth it, would it not be?
Very much. And by the way, let me just say a word about self-esteem, because self-esteem is a core of human behavior, both positive and negative human behavior. We have found, based on the research, that people who have very low and low self-esteem are much more prone to be violent. This man obviously had very, very low self-esteem, to the point that he wanted to replace his identity with a false identity. In the sense that he referred to himself as question mark. He also wrote on his arm, Al Ishmael. Okay, so he rejected his identity and tried to find another identity. If this young man, so he had very, very low self-esteem. And of course, as I said, we know that very low self-esteem renders a person prone to violence towards others and prone to violence towards themselves. Now, some of the symptoms of very low self-esteem are insomnia, excessive anxiety, panic attacks, depression, loneliness, excessive talking, alcohol abuse, drug abuse, violence in interpersonal relationships. There are many, stalking, okay? There are many signs and symptoms of very, very low self-esteem. So we need to take another look at that and so that we can understand more clearly how that puts a person at risk of becoming violent towards themselves, towards others, and then offer people treatment that's really holistic and inclusive of psychological, social, biological, and spiritual dimensions of treatment.
Very good. And of course, Dr. Poe, we're getting ready over the next minute to have our second commercial break, after which we'll have about 9 or 10 minutes, about 9 minutes to sort of overview the impact that this is having not only at Virginia Tech, but and I think you've already hinted at it when you've talked about what it means to the mental health institutions and mental health people, that it's about time that greater access be given and et cetera. But there might be some other things that you think that this might be important in terms of making us aware so that the death of all of these young people will not be in vain. And I think that if we can come out of here with something like that, dealing with young people, and well, not necessarily young people, but dealing with our population, I think that then we can say that that was a wake-up call and that we are now aware and we're going to try to do something. And of course, let me come back shortly after this second commercial break, and we'll be back with you. We're talking to Dr. Cupid.